There you go. I'm Jim Theophilus with NorthStar Advocates. And on behalf of the team here, again, we appreciate you coming and welcoming. We welcome you to this meeting. And we've been really working hard over the summer and especially August that we'll get some updates on. But just really want to ground folks in this work. It's NorthStar's vision in partnership with many of you is to build a behavioral health system, and that's substance use disorder and mental health issues. When we say behavioral health, want to build a system that is developmentally and culturally responsive to youth and young adults in general, and specifically to those young people who've experienced unaccompanied homelessness. And we started with the bridge and with the focus on exiting inpatient treatment because the data was clear that those young people were most likely to be homeless within 3 to 12 months of coming out of a system of care. Before I go to the next part, V, are you wanting to take your part, or are you at a place where you can do that, or do you want me to try and pinch hit? I'll take that as an invitation to pinch hit. And feel free to jump in if you can. So the Bridge Coalition is a focus on youth and young adults who are exiting inpatient treatment. We often say if they have the courage to go inpatient, then they ought to have the support of the community when they come out of inpatient. And again, as I mentioned earlier, the data is very clear and in some ways getting worse. That young people coming out of inpatient are most likely to be homeless than any other system of care, meaning foster care and or juvenile rehabilitation. The three purposes of the Bridge Coalition are to provide information and sharing of resources for young people coming out of inpatient treatment, to develop a return to community plan. At NorthStar, we would reject the term discharge planning. That's not meant to be disrespectful to anybody, but our experience is that really means a hard address, whereas in return to community, which the two bridge housing providers are implementing, it really implies safe housing, a safe address, but also employment, academic plan, if the young person wants it, a recovery plan, if the young person wants it. And I think really importantly, passions, interest. What are the things that you as a young person like to do or enjoy doing before your life was sidetracked through homelessness, addiction, and or mental health issues. So, and then the third is advocacy. And we're really proud of that part because it's through this Bridge Coalition and advocacy that we got Substitute House Bill 1929 passed, which established the bridge housing in both the east side and the west side of the state. So, yeah, and we've got some folks here who really played instrumental roles in that, particularly some of the young people. So having said that, we will get started. I'm always concerned that we start on time to support those who came on time, and that we'll never have enough time, but we always seem to go to the full 2:30, but we'll see how this unfolds. We got a great plan for you today, and I will start by turning it over to MJ.
Hello, everyone. I'm MJ Negron, and I'm here to introduce Noelle from Friends of Youth.
And Noelle is actually out today, so I'm going to step in her place with a couple members of our team. So thank you for that.
Well, introducing Brooke.
Yeah, thank you.
You're welcome.
And just so everyone on this call knows, I have to hop off it too, but we will get this portion going. Nice to see you all. I've attended this meeting, I think only one other time. I am Brooke Drennan. I use she, her pronouns, and I am the Senior Director of Youth and Family Services at Friends of Youth. So in partnership with Noelle and a few other folks on this call, supporting our Bridge Pointe housing program that's in collaboration with everything that Jim just kind of talked about. So sounds like there wasn't a meeting in August and this program got up and running in July. So excited to share more information with you all about it and how it's going. I am going to go ahead and drop in the chat a link to our website, which we just got up and running for more information. And then we'll walk a little bit through this for some just details about our program in case y'all don't know. And then I will be passing it over to Blanca to talk more about how kind of the day-to-day of the program has been going and what we've been seeing so far. So as Jim said, we have our Bridgepoint housing program. This is specifically for individuals who are either exiting inpatient or have been out of inpatient for the last 30 days. It is a voluntary program that they're able to come into our services if they're between the ages of 18 and 24 and do not have current stable or long-term housing. We offer them mental health services, substance use support, medication support and coordination with providers, some peer-led groups and mentorship, daily life skills support, and then connecting with the community, education, employment resources. So really trying to make sure that it's a wraparound program that's able to set these young people up for success in the community. On here is referral information. So we can accept referrals from anyone in the community, whether it's a provider, family member, young person directly, either through phone or email. So please pass that word along and pass this website along to anyone that you think might benefit from it. We're actively screening and accepting people into our program. The ultimate goal is that we will have 2 houses to serve 10 young people at a time. Both houses will house 5 individuals. We have 1 up and running currently. And so we have the capacity for 5 people, and I'll let Blanca give more info on where we're at with that. And then come October, November-ish, we will be opening our 2nd house, and we will be able to serve the additional 5 young people in that house. Blanca, I will let you take it away with how the program's going.
Thank you, Brooke. Good afternoon, everybody. Blanca Gonzalez, Program Manager, she, her pronouns for the Bridgepoint program. We currently have 3 clients. We are expecting a 4th client tomorrow. And it's looking like we are expecting the 5th by next week. So we are going to be at full capacity pretty soon. We kind of got a slow start, but we've noticed that recently the word is spreading pretty quickly about our program. So I'm getting a lot of emails and phone calls wanting to know a little more information about the program and what it offers, and then as well what the house looks like. As you know, each individual have their own bedroom, so that is very, very unique and provides an extra layer of support for the clients. We've noticed also a trend. I think for the most part, the clients are really motivated to, step into the next step or the next phase of their lives. We've noticed a trend that, they're coming to us looking for housing, support in many different areas, and just in general trying to find employment. But they do struggle at times because they either lose their documents or maybe they were stolen or misplaced. So we noticed that's like a huge thing. So that kind of like puts a pause. So we're trying to get all those things going. We just had a client that just got a job, so that was a huge win for us. But other than that, it's going really well.
Questions, comments?
I think Hala was going to chime in with a couple things too.
Oh, great, please.
Yeah.
Yeah, I think we kind of talked about our 2nd building. We are actively remodeling and adding an ADA accessible unit to our 2nd building. That's why we delayed opening the 2nd building. With the construction expectation that we'll have that building completed, remodeled and completed by the end of October. I also want to, put out a save the date. We will do a ribbon cutting and celebration of the program itself and the services both on the east and on in King County here. On November 4th. So we'll be working with NorthStar Advocates and Excelsior. And I know maybe Jim wanted to share that information, but I just want to put out there that we will be having a ribbon cutting and celebration of the program itself and the legislation in support of anyone that has been involved in getting this program up and running on November 4th. So you'll be hearing a lot more about that as the team. But I totally appreciate everybody's support on getting this program up, and we're so appreciative of having the opportunity to be providing this service. So thank you, everyone.
Well, I'll just add, thank you for announcing that. I didn't know if you wanted it broadcast that broadly, so I love it. We'll make sure that gets out to the whole Bridge Coalition. It's a beautiful facility, as is Excelsior Wellness Facility. So yeah, needless to say, we're super excited and appreciative of those who do the real work, which is the frontline providers. Any comments or questions anyone wants to make or ask?
I got a quick comment, Jim. Johnny Ota here, work for Ryther. Greatly appreciated everything that you guys have been doing, and my coworkers have been involved with referrals, and that's been really great. Yeah, I think I'm actually at the Willows right now, Friends of Youth Willows, and so I was hoping maybe of dropping by, but I was at a counselor camp training with a bunch of counselors and other people this weekend, and there's a lot of people from different parts of the state, some from Sundown and Lakeside, and they were very interested. And I can see now that once you get to capacity of the one house, then you might end up getting a lot of referrals that you won't be able to fill right away. But as it unfolds a little bit, I do think that these, Lakeside, which is very close by, and Sundown, really just at some point informing them a little bit better so that individual counselors and people who are trying to figure out next steps for people in the age range we'll just get it on their radar. So yeah, that'll be really great once it kind of opens up a little bit into those more traditional SUD treatment centers.
Yeah, thanks for sharing that, Johnny. We work a lot with them on referring young people to them, right? And so it'll be great to collaborate with them to also get referrals back into our agency for folks that need help with housing.
Yeah, cool.
Yeah, thank you.
Yeah, I'd say thank you, Johnny, for spreading the word as well. And I really do think, yes, we need to do all of that, but I also think once inpatient providers know there's a place to refer to, that pipeline will be going strong and hopefully make the case that we need to expand or at least have more long-term housing. So yeah, spread the word. Any other comments or questions? Sarah, please.
Yeah, Blanca, I had a question. What is the actual documentation? Has it primarily been driver's licenses or what are the barriers there?
It's been primarily an ID or driver's license to be able to work as well with the Social Security. That's like the main things.
Okay, thanks so much.
Awesome. The governor's been invited back to the event. We're waiting to hear back, and Representative Cortez has been invited to speak. We're waiting to hear. He has a big job in the mayoral administration at the city of Everett, but hopefully he'll be able to come, and he was our prime sponsor. So we're inviting a lot of philanthropy and legislators and citizens, provider community. So we hope to make this a big showing. It really is important that legislators see that what they passed and the money they expended, allocated to this project is appreciated and effective. Anything from the Friends of Youth team that you want to add before we move on?
Thank you, though. Nothing to add, but I appreciate it.
Thank you. And I should say that the bill 1929 and part of the original vision of the coalition was to have housing. So we really do see the coalition and the bridge housing as being a strong partnership. So we expect that at every meeting, we'll have some kind of update from providers. Katie, please, please.
Yeah, I just had a question regarding opening up the second portion of housing. Is it going to be at the same location? Are both of those going to be in Kirkland then? Okay.
It's at our admin in Kirkland. It's on the campus here. So it's a building
Okay.
next to each other. So they'll be close by.
Excellent.
Yeah, I thank you for asking that. I have to say, having consulted and worked with Friends of Youth for many decades, and then Sarah and I were able to do some training there and see the facility. I just want to thank Friends of Youth. And again, this is not any mention. The Excelsior facility is outstanding as well, with big basketball courts, and they're both just really awesome places for young people to go. Having the two houses so that there's only 5 young people in each house, being an old group home provider and foster parent, I will tell you, and a parent, there's something about the more young people you have, the more dynamics you have. So there's really something special about having a 5-bed unit that everybody can kind of go in their own house at night, but still have a lot of cross engagement is I think a model. So I love the fact that we're going to look at 2 different models, one under one roof, one under 2 roof, and just see what we learn. And that's really what this is a lot. What can we learn, and in terms of what's most supportive to young people. Yeah. Okay. With that, then I'll send it back to MJ.
Hello again. I'm here to introduce Lauren Zunker with Excelsior Wellness. Lauren, give us your updates.
Yeah, thank you, MJ, for the introduction. I'm Lauren Zunker. I am the Executive Director for our Transition Age Youth Services. Just kind of a recap of the last month, really quickly. In August, we had a training with NorthStar where a good chunk of our staff were able to attend. That was early August. And so it was just a great opportunity for our staff to connect and really orient themselves to this program. And they had a great response to it. Also in August, we had to make a quick pivot to move Bridge to the lower level ground floor of our facility, which is identical to the upstairs, but there's just kind of a more connected middle space. And because of that, we had a little bit of a delay, unexpected delay. However, in late August, early September, we were approved to start accepting referrals. Our facility has capacity to support up to 8 young people. We've also hired lots of new staff. I think we have 2 more positions to really fill out the team, but we're ready with all of our staff in place. With that being said, I've invited some of our team members here to the call. As we're getting the program rolling, I wanted to give them a chance to just introduce themselves and share some updates about the program. So I'm going to pass it over to Dylan.
Hey, thanks for that, Lauren. Hi, everyone. My name is Dylan Ramirez, he, him pronouns. I am the program manager for the Bridge program and also our other transitional age youth program through Excelsior Wellness. My role in the overall is good coordination, making sure that the individuals that are coming into the program are really welcomed, providing all the essentials they will be needing while they are with us, making sure all the staff across the board are well taken care of, supported, and giving all the trainings and everything needed and the best care that they need to provide to the individuals that we are going to be serving in the program. She's not able to attend today, but I just wanted to speak a little bit about our care coordinator. Her name is Maleka, and she plays a huge part in the Bridge program. She is there every step of the way, from engaging in the referrals to meeting with the individuals if needed in person as they come through the door, supporting them through the return to community plan, which is a huge part, as we all know, and just kind of giving them any support that they would need along the way. Like what I was saying, she works a lot in the community. We've been doing a lot of outreach in Spokane I recently attended a Spokane Community Forum that was really great to give all this information to the other individuals that were attending. Nobody has really heard much about a program like this. So being able to share everything that I was about what we're able to provide was attracting a lot of attention. And I'm looking forward to being able to have more, walkthroughs and everything like that with other local community organizations. So yeah, thanks Lauren for that. I really appreciate it. And yeah, if there's any questions, I'd be more than happy to take them at this time.
Questions, comments? Can you talk about if you've had any referrals yet or what that pipeline is like?
Yeah, absolutely, Jim. So we have had a few referrals lately. We are working through them very diligently and as quickly as we can. We're, making space for those, been working very closely with Maleka, our care coordinator, once again, on calls and everything that is needed. And we are very hopeful in knowing that we will be getting individuals in the door, hopefully within the next week.
That's great. I also just want to say how much I appreciate the approach that both organizations and the staff of those organizations. The training was well attended. People were engaged. They obviously care about this mission in both organizations. Sarah and I will be conducting clinical consultations, program consultations regularly. And sometimes staff are like, "Hey, we got this, go away." And sometimes that's true and legitimate. I'm of the belief we could always use some outside input when it comes to caring for other people's lives. And that's the attitude that we've experienced with both teams. So we're grateful for that. This is going to be hard work. These young people, again, I want to make sure that, the excitement that we're putting forward, is there and true, and we believe in all that. And some of the young people could speak to it. Some, I won't call people out, but there are a lot of people on this call who could speak to it from a professional and personal experience. These young people, as any of us would be, coming from homelessness and then trying to get rid of a substance use addiction, and or facing mental health issues. That is tough stuff. And Sarah reminds us regularly that the most vulnerable time is after someone has been without the substance for a period of time, and then if they relapse. So this is, again, just to make it okay to be for a moment, I often say if young people can live it, we should be able to talk about it. This is life and death stuff. This is the real deal. So again, I thank those on the front lines. And if anybody wants to speak to any of that, please feel free. But we're trying to balance the excitement of having a program like this that we can't find anywhere else in the country. To Dylan's comment about people haven't seen it, we did find one in Canada from Away Home Canada. And that program is in the hospital, just in a different wing of where the recovery, the inpatient treatment is. And we didn't want to do that. We wanted young people to be in the community and return to community and start their path in the community, not in a overly structured, again, no disrespect, but we wanted them in the community, back in our lives, rather than in the hospital or in a formal treatment setting. So yeah, any other comments or questions for either team?
Jim, if I may, I'd really like to
Please.
introduce our clinical lead,
Oh,
Kayla.
not done yet. Great.
Yeah, no, that's totally fine. I just want to give her an opportunity to kind of share about her role and her work in the program.
Thank you, Lauren. Good afternoon, Coalition. My name is Kayla Berenger. I'm a clinician here at Excelsior. I've been involved in TAY services for over a decade, specifically with Excelsior. So Bridge is a very welcome and exciting branch of this. We are going to be, yeah, we're ready. We're accepting the referrals, and we're kind of just making sure everything is functional. For me, it's very important to make sure that safety is at the forefront of all interactions and services. My license is actually clinical social work. So Jim, hearing you say advocacy is at the forefront, I'm like, you're speaking my language. That is true to the core of my soul. So I really appreciate that. My level of involvement will be opportunities for the young people to engage in anything that just promotes their well-being. As we know, clinical therapy is not going to be part of this process as a requirement. It will be offered in the form of individual therapy. I also conduct behavioral health groups, so I'll be offering animal-assisted therapy, specifically equine therapy. I'm trained in the HEAL model, so really excited to just allow space for this a little bit different demographic going up to age 24. It's really my calling to support and advocate for this group of people. So thank you for allowing me to speak. Happy to answer any questions anyone might have.
Oh, I'm thrilled you're here, Kayla. Thank you so much. Bring your clinical expertise and healing therapy that I love it. I'll prove my own ignorance. You say horsies because I can't say the big word very well. MJ, please.
Yeah, I was gonna ask specifically, like, is there gonna be horses brought on to the site? Or is that what your background is?
Great question. We actually contract with a local nonprofit called Second Chance Ranch. It's about 30 minutes south of Spokane, like if you're headed towards Pullman, where WSU is, go Cougs. So we've been working with the ranch for about 6 years. So we already have an established contract. I'm ready to take Bridge participants anytime. So we go out there it's mostly conducted around DBT. We use a lot of mindfulness out there. But yeah, just great partnership. We don't actually ride. So I think that's important to mention that we are not riding the horses. We're using connection and guidance to offer therapy and support in that space.
Love it.
Thank you.
Katie, please.
I have a question as it relates to coordinated entry in this program. Like, is that something that you're getting young people on those lists like right away as soon as they enter, or you're kind of assessing whether they need to be getting into that? Because I know the program is limited to just that 90-day window. So is that, how is that working with coordinated entry or like finding longer term housing?
I'll take a stab at it and then others can jump in if I might, just big picture, because this has come up a couple of ways. First of all, I want to say that everything we know and our perspective and point of view is, because one of the questions came up is, does being in the bridge housing hurt somebody who's already on coordinated entry list because they've got housing? And we're pretty confident that these young people will be in category 1. And that the bridge housing, being it's a maximum of 90 days, some will only be there 3 to 5 days, so they'll qualify. If they're number 10 on the list, it should not hurt them being in the bridge because category 1 exempts people who are in shelters and or 90-day transition programs. On the other end, I would just say, I think part of what we're trying hard to do at NorthStar, and thank you to Rachel from Healthcare Authority, is make sure we flood and support the providers with what all of the options are in terms of exiting bridge housing, whether that's coordinated entry, a housing voucher, back to family, living with friends, whatever that is. So that's why I appreciate having providers here that can make sure, if you know of resources that young people are eligible for, flexible funding, if they're in a community that has HPDF or one of the other programs. So, but Kayla, I saw you came off, so please take it.
Yeah, I would just say, kind of in the initial ideas and just planning around this, it's important for our leadership team to be really aware of resources across the state of Washington. So we are not limiting ourselves, obviously, to Eastern Washington. So Maleka and myself, that's kind of like a check mark homework is what are the resources and availability, because that will live in the return to community plan, which is discussed upon entry. As you said, we might only get a short duration of time with the young people. We might not even get the 90 days. So we need to be supporting the coordinated entry with others like immediately. So those are definitely things that are on our mind that we are kind of drawing attention to.
One sec. Friends of Youth, anyone want to say anything about this before we?
Blanca, do you want to talk about coordinated entry? If there's any, anything you can add?
Yes. So it definitely does come down to the individual, want to really pay attention to the individual needs. Some of them are very excited to just start working and getting back to the community with their family, friends, but we are definitely exploring. We understand that there's a huge gap in the housing and the resources really scarce. So we understand that there might be barriers there to try to find housing, even with the coordinated entry having long wait lists. The 90 days might not be enough. So then we really try to focus on just expanding and trying to see what's out there for them while really listening to what they really want.
I think there's going to be really another area that we learn a lot, because when we wrote the report when I was at Away Home Washington in 2018 that really revealed this data, there were many young people who spoke and talked to us around, I could have gone home and lived with my parents. I was eager to go back and live with grandma, but they wanted me to be substance free for 30 days or on my meds for X period of time. And when they sent me back to the shelter or the drop-in center that had no beds, I could not even meet that threshold. So it's going to be interesting to see how many are kind of have a plan and they just need a few days or a month or so versus those who, as mentioned, gosh, we're on day 85 and we still don't have something safe for this young person. That might turn into an advocacy issue about we need more long-term beds or vouchers or whatever. So this is an area of learning for us that I'm excited about. Sarah, please.
Yeah, I love this conversation, and not to put Rachel on the spot, and I checked, she's not here, but Rachel from Healthcare Authority will be doing a part of a presentation next month at the coalition as well, for the providers and anybody else about the specific housing vouchers and resources across the state. So that will be October, and we'll make sure that that's also then created in a PDF so that both houses and really anybody on this call has a copy of those resources that exist across the state. So that is coming up.
And thanks to Sarah's good work behind the scenes, setting all these awesome trainings up. Anything from the young people or anyone else? Anything else you want to say or ask about bridge housing in general or to the providers before we move to the next section of the meeting?
I do have something from our very first client, who I believe actually went to Life Point over there in Spokane, because that was going to be something closer to their family while they worked on everything that they wanted to achieve. Um, one of the things that they highlighted is that they finally found a program that is really paying attention to what they actually need. So going back to what you were saying, Jim, not really us forcing things on them that they truly don't need or want. It's really paying attention to what they actually want to achieve and helping them get there. And that is what we are going to take from the first client.
Thank you, Blanca, very much. Okay, well, thank you both. Both teams, please hang out. And now it's my distinct honor to welcome someone I've worked with on and off over the years. at Mockingbird Society, and then at Away Home Washington, and in between. Cecily Ferguson has been newly hired by the Office of Homeless Youth to be the Functional Zero Manager, I believe is the title, but you can correct it, for the Office of Homeless Youth in the state of Washington. We have a really awesome, again, the Away Home Washington initiated the Anchor Community Initiative, which many of you have heard of, Yes to Yes. When young people say yes, their local community ought to have the commitment, the philosophy, the resources to say yes in return. And it's my belief that when young people show up at an emergency shelter, they're saying yes. So for those concrete thinkers, it doesn't mean they have to say yes, literally. They are doing it behaviorally. And certainly when they go inpatient treatment, they're saying, yes, I want something different in my life. So again, thank you to Sarah for driving this. But Cecily, welcome, and thank you so much for all you've done and gonna do. Please.
Thank you so much, Jim, and thanks for having me at the coalition. It's a pleasure to be here and to get to listen to the work y'all are doing. I've been a fan and following from afar, so it's great to be here today. My name is Cecily Ferguson, she, her. As Jim said, I started at the Department of Commerce in the Functional Zero Manager role 2 months ago now, I think is how time has passed. Previous to that, I've been privileged and really lucky to be in and around the Anchor Community Initiative work since launch. As Jim mentioned, launched in 2019 in 4 counties in an effort to reduce and end youth and young adult homelessness, expanded to many more counties in 2022. There's 10 counties collectively working across the state using this model. I'll chat a little bit more about who those folks are, but really excited to talk with you all because you all know, and as Jim, you were just referencing, the connection between young people experiencing homelessness exiting systems of care in Washington is huge, and that's one of the main components of the Washington state work towards reducing and ending. And I'll talk about what does ending actually mean, right? That's a big word. What do we mean? What does functionally ending homelessness mean? But in that work, collaboration with the systems of care, working with y'all, as Jim, as you were talking about, is a learning opportunity to hear more about what you are learning when it comes to what young people need for housing, is really, really key. So in that, I have a presentation I'm going to go over a little bit about what is Functional Zero, what does this look like in the communities, how to get connected. Some of this is like, theory and what is the what, and some of this is how does this actually apply. So I'm going to really rely on y'all to ask some questions, help me make those connecting dots. I know there's also folks on this call who are experts and know system change work really well and can speak to the history of this. So please unmute, interrupt. I love an interrupt moment, and I'll pause for questions along the way too. I think I'll launch into it. I'm curious if there's any questions or things to say off the top as I'm pulling up my slides. Okay, cool. We will launch right into it. So again, I'm here to talk about what is Functional Zero. What does this mean when we're talking about reducing and ending youth and young adult homelessness in Washington state? I'm coming to y'all from the Department of Commerce. This position is brand new at the Department of Commerce. Previously, the work to support communities in reducing and ending youth and young adult homelessness lived at Away Home Washington amongst a lot of other statewide partners. And when Away Home Washington sunset at the end of 2024, the communities who had been participating in this work advocated really strongly, as well as the young folks, to keep the movement going and to preserve all that had been learned and built over the years. So this position was moved to the Department of Commerce to continue to answer the question of what will it take for Washington state to reduce and end?
Hey, Cecily, can you blow that up so it fits the whole screen? If not, totally fine, but it's just
Totally.
a little bit small.
Here, let me try that again and see if we can get it any larger.
Perfect, thank you.
Okay, is that any better?
Mm,
No?
nope, that's okay though.
You could
We'll-
go from
What
right,
I'm gonna,
or the
sorry, MJ?
oh, you could go to the presenter mode on the bottom right.
Oh, my bottom right. Are you talking about over here?
Yeah, where it says like notes and then those 3 views.
What I'm gonna do is, Sarah, I'm gonna send this to you, and then you can screen share as I'm talking, if that works.
Yep, that sounds perfect.
Sweet. My multitasking abilities, especially on Zoom, y'all, get limited. So I'm gonna rely on
Please do.
Sarah's brilliance here. I'm curious, as I'm sending this, has anyone worked or connected with any of the functional zero communities, or are you familiar with this effort so far?
Can you name them?
Absolutely. We've
You might
got,
not know they're in an anchor.
yeah, I was curious if anyone knew. So we'll put the list up here. We've got Spokane, Pierce, Walla Walla, and Yakima. That's Skagit, Whatcom, Thurston, Jefferson Clallam, and Clark. Okay, well then this is going to be great because we'll get to talk a lot about how to connect with those teams and who they are. Because one of, again, the key pieces is there that I would want you all to know is that there are folks working on the ground right now and trying to figure out how to better connect with you all and young people who are exiting systems of care. And getting them connected to resources. I know y'all, it sounds like, are familiar with the Housing Prevention and Diversion Fund, but we can talk more about that too, and as it relates to Functional Zero and where the efforts of this team is coming from. Jackie, it sounds like you worked with the Walla Walla crew and now you're working with the Thurston team. That's awesome. Sweet. Okay. Sarah sent you the slides. I'm going to jump into something here for a second as you're getting that up, because one of the main things that we talk about often in Communities for Functional Zero is, what does this actually mean? What does it look like? I'm going to get into the pieces of the actual measurement, but I wanted to share something with you all. So the communities, that list of folks that I was talking about, can speak for themselves. When we talk about reducing and ending youth and young adult homelessness, we get into the question of what would it look like, how would it feel, and how would you know? And what I would invite y'all to do is to open the link I just sent you all right now. This is some of what the communities who are working on this have been engaged in, and we talked about yesterday. So I just want to pause and have y'all look through, and I want to ask you, and I'd love to hear from maybe one or two people, if there's something on this board, either in response to those questions or something that you might add that's really standing out to you.
And Cecily, I've got it up, so I'm going to go ahead and you just let me know when you want me to share the screen.
Awesome. Thanks, Sarah.
I don't know if it's just me, but it's saying that I don't have access to the board.
Oh, I will update that right now.
And so I'm so glad you brought this up while people are looking. And part of why I wanted you to come is, as a former provider in behavioral health and being able to work with Way Home Washington with Jim and your team, it was always surprising to me how the disconnect between some of the systems and the work that you all have been doing. So I'm really happy you're sharing a little bit of the history as well.
Yeah, awesome. And feel free to prompt me too if there's pieces to look at. I just tried to update the permissions on that. If that doesn't work for you, I will make sure to do that at the end of this meeting so you can look at it and go and see that link later. But what I wanted to bring up, and Sarah, again, is that, like, that connection with the systems of care and looking for those opportunities. Again, I'm curious from where you all sit when you think through these questions and some of what you've heard some of the housing providers and our youth action boards reflect on. If they're, like, I'd love to hear, again, one or two folks, if there's certain answers here that really ring true to you based on what you think of when it means to ending youth and young adult homelessness from a system lens.
Well, I'll share. The first thing that popped out to me when I looked at the boards was under what would it feel like? And it's the first response is it wouldn't feel like we're always understaffed. And I definitely, I'm a parent of a youth that was in treatment. And unfortunately, I don't think I've met you before, Cecily, so I'll just share a little bit with you. But my son actually died of an overdose in 2021 after being suddenly discharged. But that was always a thing that we encountered at a lot of different points of, encountering systems. Was it felt like staff was always changing, and there was always like, you had to start over every time you even went to like, a doctor or a treatment center or counseling. There was always like, oh, that person's not here anymore. And I just have always thought, we need to value these people in these roles so much more, if that means financially or, making sure that they have the resources to build themselves up so that they can handle this work. Something's been wrong there, So that stood out to me right away when I saw that.
Thank you so much for sharing, and I'm so sorry for your loss. I'm really glad you're here. And agree, I think there's something really loud there, and you can see it got some reactions from folks in the room about, in what needs to be true around how can we show up and support young folks, is we need the capacity to do it. What also felt important about this coming up in this space was this is 10 counties coming together and talking about what they were experiencing, and this was shared. So in that, what do we know and what do we need to learn about what has to change at a system level? This work towards functional zero is both a way for communities to be connecting and troubleshooting on the ground of where do we need to add different capacity or close some system gaps. It's also feedback for the state and for where advocacy and some of that closing on system gaps on a larger level needs to exist. And that's where a lot of this work towards functional zero is living and driving towards. So Sarah, if you could pull up slide 5 for me, that would be great.
Yes, give me 1 second because I was looking at that other amazing thing. So let me share my.
Paula's got a question.
Oh yeah, sorry. Hala, please.
Yeah, thank you, Cecily. Just kind of getting clarity, because I've heard functional zero, but there's also a built for zero. There's like so many initiatives, and I'm just curious, how do they coincide? Like, are they working, together? Like, or are they, there's so many groups going on and talking about whether it's built for zero or functional zero, and I'm just curious, how does all that work come together so that we can be more productive?
That is an amazing question. I'm so glad you asked it, because it's a confusing one. And I think what's really important to know is that functional zero is the work of the Built for Zero movement. And these Washington state communities, those 10 counties, are a part of that Built for Zero work. And we'll chat a little bit more about like, what is functional zero and all of that, and what is it not? Because really a lot of this work, as you said, it's happening, and movement fatigue, initiative fatigue is real. So how are we leveraging those spaces? But I'm glad you brought those up, because they are one and the same. Built for Zero is the movement towards functional zero. And we're really, I'm really excited that Washington State is participating in the national and international movement. We have been since 2019, with the Department of Commerce more fully stepping into this role or into this work. They're also taking a bit more accountability and taking a bit more seriously what might need to change at the state level to support the Built for Zero movement in communities. So love that question. I think what I'll ask for you is I'll chat a little bit more about what functional zero is here in a second, and then let me know what is still lingering or outstanding. And happy to connect, follow up, come back, or meet with folks individually too.
Great. I'm going to share this now and let me know everyone is able to see this. Are we good?
Yes.
Okay. All right. And then I'm going to just move this here. We're still good. Okay, perfect. Okay.
Thank you, Sarah. Feel free to send these slides out later. On the notes of this slide is the link to that Easy Retro board that we were on. So you can go back to that or see it again, add to it. Sarah, if you could go to the next slide for me. When we talk about functional zero and what it is, what it means is we are working towards a Washington state where youth and young adult homelessness is rare, it is brief, and it is one time. So what this means is we're not just ending once, we're responding continually. We're also focusing on justice, right? To end homelessness, we know we need to end disproportionality too, because Black, Indigenous, youth of color, our BIPOC, gender diverse young folks are disproportionately impacted and disproportionately experiencing housing outcomes coming out of our system. A big piece of functional zero is having the data to know our impacts, to learn and to adjust. And we're going to talk more about that in a second. And a key piece, what has shaped this from the beginning, is lived experience leadership. We cannot end youth and young adult homelessness without young people's expertise and leadership, because they know where the holes are. They know what their lived experience has been in that customer service realm and what might have helped them differently. They also are in the best position to know what they need to get on and move forward with their life. So a key piece of that data is the feedback from youth and young adults. Sarah, next slide. A really important piece of functional zero is acknowledging that functionally ending homelessness does not mean that there is no young person experiencing housing instability. But Jim, to your point, it's that when a young person is experiencing a housing crisis, our communities can say, yes, we got you. We have the housing resources here. They're ready now, and so are we. So communities are working towards functional zero in that Built for Zero cohort, are working to have the capacity to prevent most experiences of homelessness. That's where that prevention and diversion comes in, to quickly identify unaccompanied young people, and to quickly resolve either connections to safe and stable housing, to new safe and stable housing, to family, to whatever that might look like, quickly resolve connections to safe and stable housing. Functional zero is a set of measures that helps us as communities determine how close we are to that. How are we preventing and where are opportunities to do better? How are we doing with identification, and where can we maybe improve or be nimble based on the experiences of young people in our communities and what our systems know? And do we have what we need to quickly resolve when young people are showing up and needing help, that we can say yes? There, next slide for me. So again, when we think of what is functional zero, it is a tool and a framework, and it helps us understand how we need to get to that end goal. And really, it's all about process and practice, which is what I want to make sure y'all know how to connect to in each of these communities around the teams who are engaged in this work, so that as you're working with young people, you know that there's also teams in those spaces who are working on this too. And part of that is communities who are in this functional zero, the Built for Zero model, are committed to a number of really key things. They are committed to having a youth action board and to having lived experience or groups of young folks with lived experience informing their work. So really great opportunities in these spaces for young folks to be leaders and to be informing what needs to change. They're working on having data, looking at system level data to inform their changes, not just the PIT count once a year, but having live system level data that informs us on any given month. How are we doing and where do we need to point our attention? They're addressing disproportionality. They are able to measure and see where disproportionality is showing up. And they're using what's called continuous quality improvement to make changes in their system and getting into a community of practice. All of this stuff I can chat about all day, but the main things I want you to know is on this next slide again of where your teams are to connect who are using this work. So Sarah, again, like here's your list of folks. I'll make sure you have contacts. Contacts are changing always. We're working to make sure those are up to date. But in each of these communities are teams of folks who are working on those pieces of prevention, identification, and quickly connecting to housing, and making sure that they have the data and the feedback from young people to see how's it going, are we doing the thing? It's a work in progress, and that's where we need the systems of care to be telling us where those opportunities for improvement are. On the next slide, Sarah, is a bit more of like, where are we working towards? Again, communities, and this is where the really powerful piece, I think it was brought up of like, what does it mean to be a part of the Built for Zero movement? Is there are communities across the country who are working in this model on all sorts of populations, and Washington State is joined the fray since 2019, but more officially more recently, and learning alongside these folks. And I'd say this group in particular has been leading the way around prevention and system of care work. So thank you all for informing that work all this time. And again, excited to make some of these connections. So I'm going to jump ahead a little bit. Sarah, if you could go to slide 11. Perfect. When we talk about system level data, some of the things I just want to flag for you all, because I think when we're thinking of young people who are exiting our systems of care, who are needing that additional support and where y'all are situated, this is where the Communities for Functional Zero can be really powerful in understanding impact, and also where the resources might be or might not be in needing some advocacy. Having that system level data helps communities understand what's happening both on an individual level for young folks, but also at that community level. So how many people are experiencing homelessness for the first time? How many young people are returning to homelessness, who have exited into housing and are returning? And what is that telling us about our system? And how many people are, like, what are the experiences moving through the system equitably? On the next slide, I'm a visual person, so when we think of what kind of information communities are looking at to figure out how their system is doing, the little piece in a snapshot of what that looks like. Where is this coming from? This is HMIS data. So for those of y'all who are familiar with the HMIS universe, a by name list, or that system level data, is exporting that raw information and disaggregating it along these lines, looking across the system, not just program by program, organization by organization, but that full snapshot of across our whole system. What has all of this looked like, and how are our programs and services meeting the needs of young folks? We're going to jump to the next slide. A key piece of reaching functional zero, and again, kind of acknowledging that this work is ongoing, is that communities are building that infrastructure, those connections, that relationships. So as things change, as young people are experiencing different seasons, different challenges, our community is in a position to be as flexible as needed and have the resources we need to do it. I think the HPDF, or the Housing Prevention and Diversion Fund, is a really great example of communities identifying the need for a flexible, centralized diversion fund for young folks, advocating for it, and then expanding it across the state. And that being a way to continually sustain, but also understand where young folks need flexibility and have our system to do it. The next slide is a bit more on addressing our equitable systems. We know that if we don't have the data and aren't designed to identify and respond, we will perpetuate them. That's another key piece of having that information, and then adjusting as we need to. This has looked like in some communities making really intentional outreach efforts to buy-in for-led organizations, to hosting diversion trainings amid specific providers, and really taking in some of that honest feedback about where some of the gaps in the system have been. But on that next slide, again, is a reminder of where the communities are and what some of the things they're doing is. So they're looking at that data regularly and trying to figure out where they can improve. They're meeting regularly around case conferencing. So if you have young folks who are in these communities or any of these communities and you need some individual or want to connect with folks, with providers on the ground, they are meeting regularly and chatting about young people connecting and collaborating. There's youth action boards. And there is an active local and state network of folks who are troubleshooting. So not just an invite to join in some of the county level troubleshooting, but if you want to join some of these conversations statewide, please let me know. The next slide, and I think I'm gonna wrap it there, is just a little bit into the weeds, and I put some information towards the rest of it. If you get really geeked out on system change theory and you wanna get more into what is continuous quality improvement, let me know. The community teams and leadership teams are applying these strategies collectively within their local work, figuring out how to do it. That's part of what my position is here for, is to support communities and making that happen, testing it out. So if that is of interest to you, and you want some support and figuring out how to bring that into your work, please let me know. I'll make sure to drop my contact information, and also just want to make sure that you all have that direct tie to the incredible leaders and folks locally in all of these communities who are doing this within their teams and in collaboration across the continuums of care and the systems. The rest is just a bunch of information. So if you want it, if your brain works like mine and you're like, oh, I'll dig into that a little bit more and see what that theory might mean, at the end is my contact information. So my email, and then I've also dropped a list of some of the Communities for Functional Zero contact sheets. So you can see a number of folks who are working. They're listed by county, so feel free to directly connect. I'm also happy to make some connections if you're like, oh, we're trying to find this thing, and we can try to work it through the network. But the main thing that I want y'all to know is that this work is active and live, and communities are really looking to partner better with the systems of care and with y'all in particular. So if you have ideas, if there are challenges that you want to chat through, please connect with me. And we're excited to see what the impact of this can continue to be. And I think, Jim, to bring it back to what you said, what can be learned about where the gaps still are and what young people are saying we can and could do to fill them. So thank you all for the time to chat a bit about what this movement has looked like. Always happy to get more into the weeds and follow up with whatever information you need. And I'm here to scheme and troubleshoot if you want to chat more about how to bring some of this work into what y'all are already doing. Pause for any questions, comments, and I know y'all got a lot of on the agenda as well.
That was terrific. Thank you very much. And shout out to Sierra Phillips and maybe others who were part of the original Anchor community work, giving us lived experience perspective. And I will say that obviously Excelsior is in an Anchor community in Spokane and was part of at least the original early work there. And there's talk of King County. There's good work in King County, which is where Friends of Youth is. So far, both these sites are located in either an Anchor community or one to be. Thoughts, comments, questions? We have a few minutes.
Yeah, we have a good amount of time. I do want to ask the providers how this partnership could benefit them, and if, like Kayla and Lauren, particular in Spokane, have you been aware of this work? Are you connected with this community? Just kind of build real-time connections here while we have Cecily.
I am learning a lot about this today. Personally, have not really had a lot of involvement in macro work, specifically Department of Commerce or anything like that. But I am drafting an email right now to Cecily to get a connection started. Always happy to honor these relationships, and obviously for bridge networking and community outreach is going to be a crucial part that we'll play as well. So yeah.
I'm excited to connect, Kayla. I've got a couple of teams in mind, especially from the VOA team that's like really deep in this like prevention work that I think would be very excited to chat with you and figure out like what that like collaboration could look like. And again, thinking of some of the West Side folks as the King County work unfolds, there's counties around you of teams that are like eager to support and help. So looking forward to that.
Yeah, I'm so glad you mentioned that. We actually have a pretty great relationship with Volunteers of America. I already have it as an action item. Once we kind of gather our bridge individuals, getting them immediately connected to VOA. I'd like them to be connected to the InReach program so that they can support housing, and also having external guests come on site for potentially my group, having a guest speaker maybe from VOA come in and talk about connections and just opportunities. And I welcome all of it.
Well, I have to say, when we started the Bridge Coalition, what we knew, Sarah and I, from being longtime clinicians and providers, is there was this disconnect between the behavioral health world and the providers who are supporting young people experiencing unaccompanied homelessness. And there was, I'll just be really honest, there was a sense among some of us housing providers that the behavioral health world was a little snooty at times around us not understanding every diagnostic term, blah, blah, blah. So this warms my heart. And I know Sarah's and all the young people here have worked so hard to see these real-time connections happening between system folks and providers. That's really what the Bridge Coalition is about, that connective tissue. And young people always benefit when folks are talking and connecting. In fact, early on in Anchor communities, I can remember how many times in Spokane and other places, but I specifically remember in Spokane, people saying, "Oh, well, I've seen you on email, but I didn't realize you were 6 blocks away from me." So even in the local community, we get so busy that we don't make that connection. So yeah, any comments, questions? Cecily, anything you want to say to close it out? Thank you again for being here.
Yeah, it's a pleasure to be here. I think, again, like starting back in some of this in 2019, Jim, I think of the conversations that we had, locally in Spokane and had, regular meetings with some of our providers here and Sarah around, with Daybreak, Excelsior, with our outreach teams, and kind of trying to shorten the path that it takes for young folks to go. And also, I think what it feels like for our providers as well. So If you have thoughts on how to shorten the path, make some connections, let me know. I think that community of practice is really deepening, and it also really relies on that like engagement and expertise that y'all have. So open door, and excited to come back and continue to learn from you all. I think I'm also really eager to hear what you all are learning, and maybe look for some opportunities, if you're game, to invite you into some of those communities for functional zero space to talk through, to share that perspective. I think that would be really, really helpful to some of the folks in that room as they're also figuring out how to better support young people. So more to come on that. And again, appreciation for the space and all the work that y'all are doing. Thank you.
Yeah, this is the beginning. So we'll be inviting you back regularly, and you have an open invitation anytime you think you have something or you heard something you want to just contact Sarah and myself, and you're welcome to come anytime, and then certainly to get on the agenda. Okay, well, we've been working on some really, I think, exciting project at NorthStar Advocates. You may or may not know we have an advisory council with young people with lived experience that meet regularly, at least monthly. And I just say this just to make sure we're in our ethics and integrity. Of course, they get a stipend for sharing their valuable time and expertise. And we also have a steering committee for the Bridge Coalition that meets the week prior to the coalition meeting to finalize the agenda, give input on what's working, what's not, et cetera, et cetera. And you see some of those members here, they're part of this agenda, but also Mayauna, who has her, like many of these young people, her fingers in many, many different pots, including doing some work with the Office of Homeless Youth, Y for Y, and they also are on our advisory council and steering committee. So I don't want to steal the thunder. I just want to make room for Mayauna to share with you something that we've all been working on. Please.
Awesome. Thank you, Jim. Can y'all hear me okay? Cool, cool. Okay. My Wi-Fi's been a little spotty the last couple of days, so hopefully it stays good during my spiel. But hi, everyone. Like Jim introduced me, I'm Mayauna, and I use all pronouns with no preferences. And I'm here, like he said, with NorthStar Advocates as a young adult with a lived experience of homelessness, mental health care systems, etc. My role today is to briefly talk, as Jim said, about some behavioral health summits that NorthStar has been brewing up. So over the last few months, NorthStar has hosted multiple planning sessions to explore how we can vision and build a more accessible, equitable, and culturally informed behavioral health system for youth and young adults. And as always, our goal is to center youth and young adult voice, a lived experience, and accessibility in everything that we do. So these planning sessions have basically dreamt up quarterly youth summits, which I'll explain a little bit more on in just a minute. We were originally thinking of doing a single or yearly large scale summit event, but during that planning, we kind of narrowed it down to quarterly, so 4-year virtual sessions, so that we can be more accessible and realistic for everyone involved, because I think a single 6-hour session is really hard for people. So we figured, being more accessible is usually better. This approach also allows for more consistent engagement and also better reflection of young people's input. So to get into a little bit of, what these sessions are, the goal of these quarterly youth summits is to essentially inform NorthStar Advocates with the best culturally, developmentally, and accessible and equitable practices for what youth and young adults would like to see and experience with behavioral health treatment. NorthStar can then use that information to ensure that our housing facility partners can truly be driven by diverse and lived experience youth and young adult voices. We plan on bringing this idea forward to the Commerce Department of the Office of Homeless Youth's Y for Y Action Board, like Jim mentioned. And that Y for Y Action Board is made up of youth and young adults from across the state, ages 16 to 26, with lived experience of housing instability. And members are decision makers in statewide work involving YHDP funds, which is a whole different thing. But I'm not here to talk about YHDP today. But yeah, just wanted to give a little insight into what they do. So yeah, basically they help with statewide decision making for youth and young adult like housing funds and grants. So with that being said, we also at NorthStar, we're also planning on developing a co-agency planning committee between us and members of the Y4Y board to ensure that these summit sessions and their topics are built collaboratively. As for a little peek into the timeline, right now, our first youth summit is planned for the first quarter of 2026. So Sarah, correct me if I'm wrong, but I believe that would just be anywhere in the first 4 months of 2026, so January through April.
Yep, yes, exactly.
Okay.
Probably
Gotcha.
months, but we'll all come up with that. You will lead that.
Yeah. And then after a year of having a summit each quarter, throughout 2026, we'll review that data and feedback from young people across the state. And based on what we learn, we may eventually organize that larger statewide, like longer youth behavioral health event in the future that I mentioned earlier. With that, I haven't been looking at the chat, so I don't know if there's questions, but I don't know if we have time for questions. I guess I should ask Jim and Sarah, and I just said a lot, so.
We absolutely have time for questions, and I'm monitoring the chat, so don't worry about that. And again, thank you so much, but I'd love to open it up for questions. And thank you for presenting, Mayauna. You've been absolutely wonderful.
This is really exciting to hear about. I'm curious, like, if and when there's more information about like either getting the word out like to young folks, like what would that look like, or how can we support ensuring like some solid youth participation?
Well, we've got a meeting scheduled that Mayauna will be joining, as well, all the young people here with the Y4Y board and OHY staff. So we're going to kind of put it in their hands and see what they come up with, and then go from there. But yes, we'll be leaning on OHY. We want to partner with OHY. That's why we reached out, so to help with getting the word out and producing and presenting. But really, it's how do we create a platform for young people to discuss and then tell us what needs to happen to build that developmentally and culturally responsive system. And again, I trip over it sometimes because I've said it so many times, it starts to sound like buzzwords, but I assure you, it is not just buzzwords. We need a system that really responds to what young people need, rather than fitting a 19-year-older into an inpatient treatment program full of 50, 60-year-olders, 40-year-olders, but rather with peers. But Mayauna, did you want to add anything to that about how others can help?
I'm really bad at answering questions on the spot.
Okay.
So I think that was really great what you said.
Well, I knew that. Others will think, oh, Jim's just being rude and jumping in front, but I knew that about you, which is why I did, but I also wanted to give you the option.
Yeah, no, I love that. Thank you.
Any other young people want to chime in on anything you've heard or about the project we're working on? I'll come right to you, Katie. Thank you. Okay, Katie, please.
Okay, well, it's a kind of similar question to what Cecily was asking, but I just wanted to remind you, Jim, as well, that I have connections to the Recovery High School. So if you want me to reach out to them in some way, I'm sure there's lots of kids there that would be interested in participating. And yeah, I'm also working with like a youth committee for my fund that I started. So I have some access to young people that might be really interested in contributing when you have more information.
Terrific. Sarah?
And I'm just going to go ahead and say, echo what Mayauna and Jim said, but part of what we're going to come out of, hopefully, the meeting with the Y4Y on this Thursday is a smaller planning committee. So we are really in just like the very initial co-design vision. So I will send out an email as a follow-up measure to this group to see if we need additional participants on that planning committee. And then we'll make sure that I keep everybody up to date on what the group has decided.
Okay. Yeah, so we're very excited about this and more to come. This is the time of the meeting where if you have any organizational updates, if you haven't already shared anything, or if you have anything you want to say for the good of the order, then this would be a time to do that.
I'll jump in really quick. Johnny Ota again, Ryther, work a lot with homeless youth dealing with the fentanyl crisis. The Dr. Taryn Hansen is starting to offer long-acting injectables for Brixadi and buprenorphine at Ryther campus. We've just initiated that. Most of it is supported by Medicaid, but if people have private insurance, they can also access that. So I can put my contact in the chat, and just anybody that's really, it's really, a lot of it is about, some of it's about withdrawal management, and some of it's about helping people sustain getting off of opioids. So I'll put my contact in the chat and we can talk more about it if you like.
We'd love to have you come present at a Bridge Coalition meeting.
My coworkers are going to contact Sarah.
I was
Great.
about to say, what are you doing in November? Because I have the perfect co-presentation to line you up.
Okay. We'll do that. We'll do it in November. What's the meeting date on November? In November.
Because yeah, it will be an
Fourth
opioid.
Tuesday of the month.
Yes.
Okay. Yeah.
Kind of like the exact that'll be interesting. It's the 25th, but still love to have you, and we'll record it and make sure it comes out. So Johnny,
Okay.
we'll talk.
Okay.
Right.
I guess I wanted to share something. Sorry, I'm so
Please.
talky today, Jim.
No, we love it.
Lots of things going on. I actually just met today with Seattle Foundation with my partners there that are hosting Jaden's Community Support Fund, which is the fund I started in my son's honor. And we currently have over $60,000 there, and we are looking to make our first donations. So I have a youth advisory committee that's trying to find orgs that we can donate to, and they have to be 501c3. But I'm going to put the link in the chat just in case anybody wants to reach out with me with a recommendation of who needs funding, especially in like the current climate. I know a lot of organizations are struggling to like meet their goals. So if you know of something that's kind of in alignment, we're wanting to support youth and young adults in finding like successful pathways to health. So and then on my youth advisory committee, we're probably going to start donating quarterly and then continuing to fundraise as well. So just going to put that in the chat so you can reach out to me if you want.
Well, and since you put it out there, let me just say how respectful I am of you and grateful to take such a tragedy and turn it into something positive for Jaden, but also for the community. So thank you. This is a statewide fund, is that correct? Or is it county?
We had sort of thought about like donating to King County organizations, but I think the youth on my committee would probably be open to anything. The reason I was talking with Seattle Foundation today is because they're going to feature our fund in their annual report, which is really beautiful.
Nice.
And that was kind of one of the things we talked about was just, transmuting grief and pain into something that is beautiful to honor my son. So it felt really good.
Well, again, more in the spirit of this touches everybody. Many of you may remember that a couple months ago, my own niece died within 6 hours after being discharged from unexpected. Well, it was not planned, but they were upset with her for something. And so in the middle of the night, they discharged her and she was dead within 6 hours. So this is touching us all, and this is why the Bridge Housing is here, as well as the Bridge Coalition. So, and I think I speak for Sarah to say maybe one of the upcoming meetings you can also present an update on the foundation and go into more detail, have more time for that. And I would say that maybe there's a way to put together a request for some of the flexible funding for residents at Bridge Housing that helps with their return to the community. Anyway, thank you for that, Katie. Any other updates or anything anyone wants to say before we close? Sarah? Anything you want to say?
Just happy to be here and the full circle moment, and just so grateful for everybody's participation and really seeing that cross collaboration and community, individuals, providers, systems coming together, and I'm really excited what we're all co-building here and imagining and creating. And thank you, Mayauna and MJ, for speaking, and Cecily and everybody here.
Indeed. Thank you all for being here. I also do want to just say, in the spirit of community, thank you to Jackie. I know a lot of these young people are going to have legal needs as well, and we've talked a little bit to LCYC, but yeah, we are trying to treat young people as holistic human beings who have multiple needs and just an incredible future if we support that. All right, last call for closing comments. We'll come under budget today.
I just wanted to come off mute real fast and say on my end, thank you for letting me be part of this. This is my first time being able to join this, and just once again, echoing what everybody else has been saying, just seeing the commitment and everything that's going into all the great work that everybody is doing for the better good of why we're all here is absolutely amazing. So thank you everybody for that, and I look forward to continuing this with you all.
Well, thank you, Dylan. And I guess I will say the last comment, those of you who are making connections with inpatient providers specifically, but even other providers, please tell them about the Bridge Coalition. Please let them know they can present their program here, have them get a hold of Sarah. But yeah, let's broaden the table, make room at the table. There's always more room at the table. All right. Take care. Thank you for what you do.
Thank you.